Well, welcome back. February is American Heart Month, and heart disease is the leading cause of death for both men and women in the United States. Joining me this morning from the UConn Health Calhoun Cardiology Center is Dr. Eiko Schmidt. Thanks for being with us.
Thanks for having me.
So tell us a little bit about the work that you do, Doctor.
So I'm one of the cardiac electrophysiologists at UConn Health Center. So what I basically do is treating patients with arrhythmias, putting in pacemakers, putting in defibrillators. But I also do general cardiology, so I see a lot of patients who have general cardiology issues as well.
And I'm sure you see a lot of that because we know how prevalent it is in the U.S.
It's a very common disease. For instance, heart failure is very prevalent, meaning there are a lot of patients in the United States have this disease. If you look at the numbers, there are approximately 6 million people who suffer from this disease, and it's expected to become even more prevalent, so more people with the aging populations are going to develop heart failure.
What do you tell people in terms of, are there things that they can do to try to prevent it, to live healthier lives?
Absolutely. So if you think what the major contributor is for heart failure, in general heart disease, it's coronary artery disease, meaning blockages in your arteries that supply your heart with blood and oxygen. So there are a lot of things that you can do. For instance, if you have high blood pressure, this needs to be very well controlled. If you have cholesterol elevation, you should control your cholesterol. But it is also important to make sure that you exercise on a regular basis. Preferably, you should exercise 30 minutes pretty much every day. So this is how you can prevent these diseases from developing.
And I know a lot of it can be like genetic and family history that plays a big role in it. If you know that you have this in your family, how can you stay on top of it? How early do you have those conversations with your doctor?
So I think if you have a strong family history of heart disease, certainly you should see your primary care physician and possibly also your cardiologist. And I think you have to touch a lot on preventive measures that I just mentioned. And because of your genetic dispositions, you might be at higher risk for heart disease. And in those patients, it is even more important that you control all the risk factors leading to heart disease.
Has treatment come a long way in this?
Oh yeah, there is really a lot of development in this field in cardiology. I think we have to come along and shift a little bit more towards prevention, however, because what we treat as cardiologists is the end stage when patients already have disease. So, however, there are a lot of treatment options. There are a lot of medications have been developed, especially in patients who have a weakened heart muscle. Those patients, when they're treated with the right medications, they do actually fairly well. If you have more advanced heart failure, this is where I come into play. Sometimes patients can develop bad arrhythmias. They come from the bottom chamber of their heart. And in those patients, they are at risk for dying suddenly. It's called sudden cardiac death. In those patients, they need to be protected by an internal defibrillator.
Okay. And this is just the examples of the things that you do at the health center.
That is correct, yeah.
All right. Thank you so much for being with us. We appreciate it.
Thanks for having me.